Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical, and it is November the 24th, 2 days before Thanksgiving, and we are opening up here and getting ready to receive your calls. I wanted to make an announcement first. The drive-through service is back open. We do have approximately 150 COVID rapid tests available this morning. I will say that they're going so fast that it's hard to keep up with supply and demand. So if that's a service that you need this morning, if you need to be verified or you are wondering whether or not you're COVID positive or not, the rapid test is not a great test, but it is a great test if you compare it to whether you're having symptoms and whether you've been exposed and all that other stuff and how long ago you were exposed and things like that. So the COVID-19 rapid test is here. It's $60 cash. It's something we don't bill insurance for. So if you think you need one or you know somebody that needs one, I recommend you act promptly because they are going fast. And even if you want to call the office this morning and reserve one, if you go ahead and pay for it, we'll keep it for you. So you can just do the drive-through, and we're going to do this till we run out again. But also with the drive-through stuff, we're also doing flu shots, and we're doing B12 shots also. So drive-through services is up and running. The next thing I want to tell you is the telemed stuff. The telemed stuff is working great, okay? And I feel like we've been able to deliver people their needs and do it in a respectful manner and get it done with the telemedicine. So I encourage everybody to get somewhat comfortable with this technology, okay? Because this is the future. We were shoved into it a little bit faster than normal. However, I'd been studying this modality for years prior, okay, and I've done some telemedicine nationwide. So it's working. It's not the best thing. I think the best thing is always seeing the patient in person. You get so much more information about what's going on, okay, but under these circumstances and the fact that we'll be able to use telemed to give you better access to us and provide you with services from here on out in a better fashion, more accessibility. So use the telemed, okay, get used to it. And some people have asked me, was there anything I can do to help with the telemed visit? I said, absolutely. First of all, make sure your technology is all good. The next thing you need to do is some things you could buy that would help us. Number one, a temperature gauge. To take your temperature, a blood pressure, automatic blood pressure cuff, and we use the ones in the office here. We got it from Walmart for, I believe, less than $20. So you got a temperature, something you can check your temperature, a blood pressure thing, and then the pulse oximetry, the little thing you go on your finger, and that tells you what your oxygen level is and your pulse, and you can compare that to what the blood pressure cuff pulse is, and that gives you a great idea what your pulse is, what your blood pressure is, what your oxygen saturation, what your temperature is. Those are the things that we're mostly interested in. Those are vital signs, and there's a reason they're vital, okay? So if you want to help out that technology, if you go pick it up, purchase it, it would help. And plus, if you ask me what's an ideal home monitoring situation, and those few things would be elementary to home monitoring and monitoring your own health at home. Okay. The next thing is I've talked about the CCM, the chronic care management. A lot of people don't know, but I actually hired a concierge nurse to utilize these programs to provide you guys, my patients, with the highest level of service that I could possibly do. And a lot of people don't realize that, and I don't advertise it like that, okay, but the chronic care management component, I've hired somebody, her name is Reagan Beck. No, we're not kin, or we're kind of kin, but far off. And that's what she does all day, is manage these programs, but she manages them such a way to give and propagate whatever you need and gets it done rapidly. And she is very experienced from the medical side of things. So she's running those programs, okay, and a lot of people, listen, it don't take that much cooperation to work with us. We're pretty streamlined, okay, but it does take some cooperation. So we're still getting people who are demanding a lot of things but are refusing to sign up and be a part of the program. And I'm just trying to encourage them, hey, chronic care management is a way for us to provide you with services. And I have a dedicated nurse, and that's what she does, is she looks after my chronic care management patients. And she's a concierge nurse. In other words, if there's issues with those patients, it goes straight to her. She does whatever she needs to do or what she thinks she needs to do, and then she comes to me and clears it with me so we can get you taken care of. So please look at that, see if you're eligible and sign up. And if you have a question, you can call and talk to Reagan. She'll talk to you about it and make sure everything's all set. Okay, last but not least, the COVID count is 548. That's up from 3 from yesterday. Okay, hopefully this 10-day reset that we're doing and hopefully the community can cool down from the COVID thing to where we can all go back to functioning normal next week. So please do your part and social distance, wear your mask, use your alcohol hand sanitizer, and let's see if we can't push this back under the radar from Rabun County. So please do your part. I know we're doing our part and we're trying our best to navigate and not to try to help you and keep you taken care of while we do our part to be respectful of everybody's health and the health of the community. All right. This is Dr. Timothy Scott Beck. I think I've talked enough this morning. It's always good talking to you, and I really appreciate people that listen to these videos. Thank you so much. Have a great day.